Dear students, today I want to discuss about the poisoning in children. Now, what do you mean by poisons? Poison is any substance that causes harm if it get into the body. It can be mild, severe, or may leads to death. So, any substance which produce the harm of the body. Route of exposure: ingestion, inhalation, contact, as liquid, spray, mist, and injections. So there is four way to produce poisoning in the human body. That is ingestion, inhalation, contact, and injections. Route of excretion: poisons when ingested or inhaled, they are excreted from the body through the urine, feces, sweat, and lungs. Exposure to a poison: acute exposure and chronic exposure. Single contact that lasts for seconds or minutes or hours, or several exposures over a day or less. So, the acute exposure needs only seconds, matter of seconds or minutes or hours to producing poisoning. Chronic exposure: contact that lasts for many days, months, or years. So, chronic exposure for poisoning, chronic poisoning may need many days, months, or years. Mode of poisoning: mode of poisoning in children mainly accidental poisoning, but in adolescent self poisoning is important, that is attempt to suicide occurs in young adult and adolescent. And poisoning at works, that is in painting shop or in any chemical industries. Accidental poisoning: accidental poisoning usually occur in children when swallowed substances used for poisoning. Most important accidental poisoning in children is kerosene poisoning. Kerosene used in as household fuel. And next common poisoning is the medicine such as paracetamol, para-aminosalicylic acid, and sedatives. And one of the most common accidental poisoning usually occurs in the rural area, which is organophosphorus compound poisoning. Usually this organophosphorus compound used in agricultural pesticides. And another poisoning is a household cleaners, bleach, detergent, and disinfectant, and paints, and most important in snake bite exposure, which producing envenoming. So when you asked in Viva board what are the common poisoning in children, your answer is kerosene poisoning, and then organophosphorus compound, then snake bite, and any other poisoning is paracetamol, salicylates. Now, some conditions where the poisons are used as self poisoning, this is organophosphorus compound, this is OPC, sedatives, medical products. Now, how can you diagnose poisoning? From diagnosis of poisoning, you should take the medical history, psychiatric assessment such as psychiatric disorder, personality traits and disorders, previous self-injury, risks of further overdose and subsequent suicide, family and personal history. So, this history is very important when you take the history from the patients, because these patients are vulnerable to take poisons for suicide. Toxicological and socio-economic history. History of circumstantial evidence such as suicide note, circumstances in which the patient was found, smell of ingested substances, drug container, tablet or capsules. So this circumstantial evidence is more important to find out the type of poisons. Common clusters of features of poisoning such as smell of OPC, bronchuria, hypersalivation, incontinence of urine and stool, and meiosis. Meiosis means constriction of the pupil. If these sign symptoms present, you think patient suffering from OPC poisoning until proved otherwise. If the child present with nausea, vomiting, tinnitus, deafness and hyperventilation, metabolic acidosis, you suspect patient suffering from salicylate poisoning. And if a patient present with meiosis, reduced respiratory rate, you suspect patient suffering from opioids poisoning. So these are the feature of clusters of poisoning. Now investigation. How investigate a poisonous patients? Toxicological investigations. Toxicological investigation includes screening of the blood or urine for paracetamol, salicylates, iron, ethylene glycol and benzodiazepines. So blood and urine screening done for this type of poisons such as paracetamol poisoning, salicylate poisoning, iron poisoning, ethylene glycol, benzodiazepine. These are the more important blood screening and urine screening. Screening of unknown toxins. When a patient comes with you with unknown toxin, you should investigate it for benzodiazepine and paracetamol measured routinely in blood and urine. Urine takes 20 ml because this benzodiazepine and paracetamol poisoning is also common in children. Non-toxicological investigations. The inspection of broad specimen such as container or medicine containing bottles. Inspection of the blood. If you inspection of blood, if the color of the blood is chocolate color, it indicates methemoglobin, that is dapsone nitrates poisoning. If color of the blood is pink plasma, you think there is sodium chlorate poisoning. Is brown plasma due to myoglobin, it indicates rhabdomyolysis. Inspection of the urine, brown discoloration due to presence of hemoglobin, that is intramuscular hemolysis. So there is, if you find the urine color is brown, you think there is intramuscular hemolysis. And if you find the crystal, it indicates ethylene glycol poisoning. And hematological investigation little value, biochemical investigation and radiology and ECG. Radiology is some kind of poisoning such as iron poisoning. Diagnosis style of antidote. Some antidotes are given for diagnosis of unknown poisons. To make rapid diagnosis and noticeable clinical improvement occurs within 1 to 2 hours. So if you give some antidotes and improvement of the patient occurs within 1 to 2 minutes, you suspect patient suffering from that type of poisoning. That IV naloxone for opioids, IV flumazenil for benzodiazepines. Principles of management of poisoning. It is very important. It is usually given in your SAQ. Outlines of principles of management of poisoning: rapid assessment, immediate resuscitation by ABC method, prevention of further absorption and increased elimination, use of appropriate antidote, supportive care, treatment of complications such as care of unconscious patients, convulsion, control of body temperature, either hypothermia or hyperthermia, stress ulcer and bleeding, appropriate toxicological and non-toxicological investigations, counseling of the parents and child, follow-up, prognosis, and preventions. So these are the outline of management of poisoning. Any poisoning, any poisoning, when admitted into hospital, you should assess the patient rapidly, then resuscitate the patient by the ABC care, and then you should take the measures to prevent the absorption, and also some medicine used to increase the elimination of poisons from the body. An appropriate antibiotic should be used if available, and others measure supportive care, and also you should look at the look for the complications and treat it accordingly. And some investigations are are done to find out the toxic substance in the blood, and after stabilize of the patients, you should counsel the parents, and if you are adolescent, you also counseling the patients, and follow up prognosis and prevention. Now, rapid assessment of poisoning patients. Rapid assessment means you assess the vitals such as pulse, temperature, respiratory rate, blood pressure, capillary refill time. And how can you assess the vitals? That is airway, breathing, circulation. By airway assessment, you should look at the awakeness of the patients, ability to talk, and likely to have intact airway. If patient is lethargic, gag reflex should be checked, and if it is lost, indicates airway reflex is likely to be lost. And how can you assess the breathing status? By observation of the ventilator support, respiratory rate, cyanosis, use of accessory muscles of respiration, SpO2 by the pulse oximetry. Remember, indication of oxygen inhalation by observation of the pulse oximetry. If it is less than 90%, immediate oxygen inhalation. If 90 to 95%, oxygen inhalation necessary. If more than 95%, normal, no oxygen needed. So if any patient present with you with respiratory distress, you should monitor the patient by the pulse oximetry, and if you get the oxygen saturation less than 90%, you should give the immediate oxygen inhalation. If it is 90 to 95%, oxygen inhalation may necessary. If it is more than 95%, oxygen not needed. Now, circulation assessment, blood pressure, pulse, and capillary refill time. By ECG monitoring in case of tricyclic antidepressant poisoning, oleander poisoning, dehydration toxicity, and beta blocker poisoning. In this case, you should monitor the ECG. Do the ECG for monitoring of the cardiological status. Shock. You should assess the shock. For shock assessment, you measure the systemic blood pressure. If it less than 90 mm mercury in adult, and if it less than 80 mm mercury in children, you think patient suffering from shock. Or if capillary refill time more than 2 to 3 seconds, you think patient suffering from shock. And next assessment is the level of consciousness by the Glasgow Coma Scale, and also you should look at the gag reflex. Second measurement is immediate resuscitation by the ABC method. In A means to maintain the airway patency by full tongue forwardly, clear airway, extend neck and raise chin, turn the side semi-prone position. So by this way you keep the airway patent. And how can you establishment of the breathing? By the oxygen inhalation if required, assisted ventilation if required, such as mouth to mouth breathing, or bag and mask ventilation, or mechanical ventilation. And how can you establish the circulation? By open an IV channel, and if there is fluid loss or shock, you treat the patient with IV fluid, and if no pulse, you should do the cardiac massage. Prevention of further absorption and increased elimination. It is one of the most important steps of management of poisoning. How can you prevent the further absorption? Prevent the absorption from the skin by remove from contaminated environment, remove contaminated clothes such as organophosphorus compound and kerosene poisoning, because from cloth these substances are absorbed into the skin and blood, and also the clear the skin by thorough washing. And how can you prevent the absorption from the stomach? You should do the gastric lavage if the patient comes within 4 hours of poisoning, such as iron, salicylates and organophosphorus compound poisoning. And this poisoning you should must should do the gastric lavage within 4 hours of poisoning. Emesis by the pharyngeal stimulation with fingers or syrup epica, it is done usually in the adolescent or older children. And absorbent by the activated circle, in that case aspirin and paracetamol poisoning is very most important, because this activated circle is prevent the absorption. It adhere to the these toxic substances and prevent the absorption. Purgation by the magnesium sulfate. Increased elimination by the alkaline diuresis, especially in the acidic medicine such as salicylate poisoning. And another way, the acid diuresis, dialysis and hemoperfusion. So if not respond the patients of above measures, you should sometimes need the dialysis. Use of appropriate antidote, such as for paracetamol poisoning, N-acetylcysteine methionine; in OPC poisoning, injection atropine, injection palidoxin or obidoxin; in case of iron poisoning, desperioxamine. And also you should need the supportive treatment, the nutrition, hydration, fluid and electrolyte balance, and bowel and bladder care and care of unconscious patients. Treatment of complications such as shock, hypotension, convulsion, hypothermia, cardiac conduction defect. So if this complication found, you should treat the patient accordingly. Appropriate toxicological and non-toxicological investigations, and after the settle of the patient, you should counseling the parents and child. Now you should follow up the poisonous patients by the clinically when patient is admitted, when patient is in the hospital, vital sign monitoring to find out the capillary refill time, and also you should observe the complications. The most important complication is shock if the systemic blood pressure is less than 80 mmHg and CRT more than 2 seconds. And you should follow the laboratorically, such as you do the serum electrolytes, renal function test, liver function test, you do the ECG in case of TCA, Ritalin or beta blocker overdose. Prognosis depends on type of poisoning. Early diagnosis and quick intervention reduce the mortality. How can you prevent the poisoning? Medicine keep out of reach of children. Kerosene should be kept in storeroom. Now very important topics for your Viva board. Indication of gastric lavage. When you do the gastric lavage in case of poisoning, if the patients come with you within 4 hours of ingestion. In the case of salicylate poisoning, organophosphorus compound poisoning and iron poisoning. In 3 types of poisoning, gastric lavage is important if patients come with you within 4 hours of ingestion. Contraindication of gastric lavage, most important is kerosene poisoning, because if you do the gastric lavage in kerosene poisoning, it is aspirated and producing aspiration pneumonia. And of course corrosive poisoning, because if you do the gastric lavage in corrosive poisoning, that is perforation of the stomach, esophagus, so it should be contraindicated. Indication of activated circle, nowadays it is not used, but it absorbs the poisons and decrease absorption. It is usually used in the aspirin and paracetamol poisoning. Now procedures of elimination of poisons such as post diuresis, alkalinization of the urine and dialysis. So alkalinization of urine, in alkaline media, acidic drugs become ionized, but it is not lipid soluble. Increase urinary excretion. So in alkaline media, acidic drugs are excreted because this acidic drug becomes becomes unionized form. Unionized form drugs usually are lipids insoluble and they easily excrete to the urine. Ionized drugs are lipid soluble, so it is usually absorbed and producing more poison, more sign syndrome poisons, and it is excreted by the kidney. Ionized drugs are lipid insoluble and excreted by the kidney, but unionized drugs are lipid soluble and increase renal tubular reabsorption. So when you take the history that this drug is either acidic or alkaline, if drug is acidic, you should do the alkalinization of the urine, because in alkaline, if you do the alkalinization of the urine, in that cases these acidic drugs are ionized and they cannot be absorbed and excreted by the kidney. So name of the some antidotes used in poisoning, sometimes it is given in the SAQ. In iron poisoning, antidote is desperioxamine. Paracetamol poisoning, N-acetylcysteine, methionine. In OPC poisoning, injection atropine, injection polydeuxin or obidoxin. In benzodiazepines, flumazenil. Opioids, naloxone. And digoxin poisoning, digoxin specific antibody digibine. In copper poisoning, D-penicillamine. In arsenic poisoning, DMSA, that is dimercaptosuccinic acid. The analog is Bell. And arsenic poisoning again as lead poisoning and gold poisoning and zinc poisoning, dimercaprol. And vitamin K1 is given is warfarin overdose or warfarin poisoning. So dear students, here I only discuss about the principle of management of poisoning and some importance topics for your viva board and also for your written examinations.